time I'm going to lecture about something, or in this case, tell you the story, I like to have sometimes quotes. I use it a lot in my lectures. But this one that I found, it was, really nice. My nephew Amir gave it to me before I was going to lecture 4 hours in root resorption to a group in Pasadena with Dr. Marchak. And it says, what you do makes a difference, and you have to decide what kind of difference you want to make. And this Jane Goodall was the one who wrote it, and the kind of difference I want to make in every episode is to try to help you to understand that we can avoid problems in dentistry, and that external root resorption is not the end of the world, and it is important that we find it at the right time, as fast as possible, so we don't lose the tooth and we don't miss the window of time that we can miss when we don't have a right diagnosis. And then I put a slide of if resorption a disease or is a reality, it's a mystery, it's a myth, it's a painful. What is it? How do we diagnose? How do we classify it? How do we do treatment options for the patients? So when you go to see your endodontist or your dentist and they said, oh my God, you have root resorption. What, you have to take the tooth out. Please don't do that. Send me a message, call my office with the website. I will try to check. If you have no way to save in that tooth, I will let you know. Because sometimes not all of us have the right information. I am passionate about this topic. So I will explain to you that you will have this space, but it's no bacteria. That's the key in resorption. And it doesn't hurt. And guess what? This is the destruction, by definition of the American Association of Endodontics, is the destruction of these calcified tissues. And as you see here, is like a bite of a rat on the root. And as you go internally in the root, imagine the acidity of the bacteria that destroys our tooth. Similar happen of enzymes on osteoclast, which is the cell that destroys the bone, because they think they're fixing something. They're taking care of the inflammatory problem, and they keep resolving the root on the only thing that is left probably is the nerve, or you cannot do anything because now you lost the tooth. And the American Association of Endodontics in 2014 came up with another definition that there was not a disease, but it's a condition. Yeah, it has never been a disease, but it's a condition where the body reacts in a physiological way to certain causes of trauma. The body reacts in the area that they feel the trauma is present. And that's why in another of the episodes, I was showing that this is one cell only. And around this cell, imagine the amount of genes that are running, because we have to communicate, the molecules communicate between one another on the presence of inflammation. These type of molecules are always going to be present, and they were present when I did my studies in root resorption. And nowadays that we have the way to compare more where the molecules are, where the genes are, for medio I did microarrays, and now they call arrays, to analyze how many genes are present after the injury on a root canal, which was part of, well, actually was my topic of my PhD. So once we went and find out the molecules, I start recommending, and we did studies with anti-inflammatories, that they will stop the amount of inflammation, and therefore we may avoid and sometimes have the beginning of root resorption. How do you know what is internal and external? I explain an internal has to be inside, it's rounded, and the external is like a rat bite your root, and it's like, I think like a rat biting cheese. And after that, the destruction continue and continue and continue until you don't have a tooth. And sometimes the patients, this is not for people that, whether they have money or no money, it's about the dentist telling you that you have resorption, internal or external. If the dentist doesn't mention, please ask them, can you please tell me if I have any internal or external resorption? There's another classifications that everybody in their own call start giving, But when they are published, we have to respect that and mention it if we need to use them. Now, what happens when you have an accident like this? It's important that they ask you what is the history of your trauma. That's what I have this paper that was created from USC, most of the questions there. I add some others. But in this trauma, the patient fell, then had orthodontic treatment. And usually, this is not the case, but usually there's no pain and it's discovered with radiographic findings. It can be that the nerve is very inflamed and need a root canal, but sometimes it can be that they will not need a root canal, depending how bad the patient felt. And also, if the patient is grinding, that is when you are grinding and have no stop, your teeth are traumatized every night, sometimes during the day. And what is going to happen? That these surfaces are going to be flat, and then it's a trauma, and the cells, even if you don't have braces, may start the resorption process. That's why we cannot say, oh, orthodontic treatment is the cause of my resorptions. No, that's something that can happen during resorption, but it's not only the orthodontic treatment, it's many factors that are involved for us to have a reaction and the cells start resorbing the roots. Also, believe it or not, when you have your gums that are not healthy, then you can cause inflammatory issue and you can cause resorption. And if you have a systemic disease like diabetes, lupus, etc., that can also affect patients with cancer in radiation. That can affect and create root resorption. That's why, as a dentist, when they take an X-ray of the full mouth, they always have to analyze the medical history and know what type of traumas you could have that you can have resorption, and look at the X-rays. If by any chance they don't tell you anything, feel free to ask your doctor, can you check my resorption? And if you have any resorption, when you come to our office, we will go to a series of exams to, percussion, palpation, the water, the bite test, every single one that I have explained to you. And the other study that we use almost 100% is the combing CT scan. Why? Because it will allow us to see the size of the resorption, like in this case, because it's a study that it's like they're sliding the roots in this way and also in a vertical way. So we analyze the size of resorption, the exact position, how bad or how much tissue is destroyed, and that's the only way that we analyze in more detail. But we don't need for everything the combing CT scan, because even if we have it in our office, doing it routinely, I'm not agreed yet on the topic because it's a full mouth radiation. So if you really don't need it, like me, you have more than 25 years doing root canal treatments, then you can really make a decision with your clinical judgment if you need to have a combing CT scan. However, in the resorptions, I usually 100% almost I have to use a combing CT scan. So in this case, this resorption that you see here is external. And this patient, who is the father of one of my students, got to me because they told him to wait, and she didn't know that the father has this until the father mentioned it to her. And when she saw the X-ray, she was very mad because they were living in different states. I did a root canal. The patient is surviving with the tooth, but because the daughter is watching that, he doesn't bite anything. So this tooth will be for a show only, because look at the amount of destruction is amazing. It looks worse here and in the CT scan worse, but it wasn't that bad, and the patient still has the tooth. But this is the external, it's outside of the root. And inside is like a little round little container that you will see inside in any part of the tooth. Resorption can be placed in this part, sometimes the cervical area in this part, sometimes can be lower. The most predictable external resorption I have seen is when you have the resorption for orthodontic treatment, where the roots start resorbing from here up, so the roots get flat. But if the roots start moving and they don't stop of the movement, you really have to see an endodontist to stop the root resorption. Maybe you are on time to stop and don't lose the tooth by an endodontic treatment. So be aware that we have the internal is extremely predictable, and the external that is also by orthodontic treatment is predictable. And by saying that, I want you to know from this episode that the difference between internal and external resorption, and to know that you can be treated. And if you have any questions, please write your comments or your questions to the channel, or if you want a consultation, you can call to the office, and the phone number is on the website with my name. I hope you like the episode and you have learned now the difference between internal and external, that internal is a lot more predictable, external too, depending on the size of the structure of the tooth. See you in the next episode. Thank you, and see you next month.